Okay. Good morning. Today's presenter at the Spiritual, Physical, Emotional Cleansing Training is Dr. Santy Kit-Ling Lee. Dr. Lee earned her PhD in clinical psychology at a California university, and her postdoctoral degree was in brain health and behavior. She is a registered clinical marriage and family therapist in American Clinical Marriage and Family Therapist, and she's also received certificates from a College of Nutrition in Toronto. You can find her talks from 11 to 59 at her YouTube channel, Santy Lee Messianic Healing, and her talks 1 to 11 or 1 to 10 at House of Israel UK. The title of today's talk is Adult Attention Deficit Hyperactivity Disorder, Case Studies Part 2. Let's welcome Dr. Lee and most of her students.
Thank you for introducing me. I'm so happy today because we have participants from different parts of the world. My student who's going to present, Joanna from Trinidad, Delore from USA, and Oslin, faithful attendants from England. And then Abigail from Canada. So over the world, we cooperate and have today's meeting. And today, I would like to talk about talk 60. So let's go. And this talk is the continuation of previous talk 59. Today is part 2. 59 is part 1. Okay, similarity at talk 58 and 59, we talked about 12-step guide for adult attention deficit hyperactivity disorder, that is ADHD, by this program called Friends in Recovery, 1996. It talks about spiritual and emotional management. So I particularly select the step number 10, goal number 3, peace with others. It's a continuous reflection and changes of our mistake. People, especially people with adult ADHD, apply behavioral modification and how to be accountable. Today, we focus on impulsivity. Impulsivity is one of the major weaknesses of adult ADHD. My student Joanna and Delore will provide us some guidelines of overcoming impulsivity and give examples. So after the presentation, I will summarize the presentation. Let's invite Joanna from Trinidad. Let me make you host.
Sure.
Okay.
Sister Santy, you can select the Joanna only name because I'm sharing the screen with that one.
Yeah. So I have to select you. Okay.
Yes.
Put your name here and put you host. Make host. Okay, I already select you, but I couldn't find make host. Let me see, do it one more time. Here, I found it. Okay, so now I put you host.
Okay, I think, let me just double check here. So I'll switch to the other one from here. Give me one moment. All right. All right, so I'll begin to share my screen and you let me know if you're seeing this screen. Is everyone seeing my screen?
No, Yes.
Yes, 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 I
with the
can.
presentation?
Yes.
All right, wonderful. So that means all right, so I'll begin. Shalom, everyone. My name is Joanna Pierre, and I am from the beautiful Twin Isle of Trinidad and Tobago. And today I'll be presenting on overcoming impulsivity. Right, so the introduction, let me open this slide a little better. All right, so in today's presentation, we'll be discussing one of the most common weaknesses of ADHD, some of the ways it affects individuals, and some of the ways in which it can be overcome. For this presentation, I'll use some examples of my patient, Miss Janice Rock, and discuss some of her challenges with ADHD and the treatments she undertook to help her overcome impulsivity. What is impulsivity? The definition of impulsivity is defined as the definition of attention deficit hyperactivity disorder.
So
Sister
Joanna,
Santy.
we cannot see the introduction slide.
Oh, you didn't?
Advance it.
Is it that you're not seeing my screen at all, or you're not seeing the slide?
This
Advance it.
introduction slide.
Are you seeing it now?
No, only see the cover.
I don't know why.
Number
I'm
2.
changing the slides. It's funny. Let me try and come out and see if this would. All right, let me.
Austin, I want to see your mouth.
All right, are you seeing it now?
Austin. Yeah.
I'm struggling to see what I'm
Are you
doing
seeing
here.
anything at this point?
Yes.
Are you seeing the introduction slide?
No.
I
Yeah.
don't know why it's not
Number-
changing, honestly.
The cover. Just the cover.
Yeah, I realize it's still on the cover, which is strange. Hold on. I'm not sure why. Right, so let me try again. I'm going to stop share and try sharing again because I'm not certain why it's not.
Okay, try to see.
Yeah, sorry about that. Let me try again. So I'm going to start again with the shared screen.
Austin, I want to see the whole head.
I'm trying
So
to
are you
sort out my
seeing
phone.
my screen?
Cover.
Yes.
Still the cover.
Oh, there you go. Good.
I think maybe there's a delay and I'm not sure why.
Okay.
But you're seeing it now that I'm switching, okay?
Yeah, that's good.
Okay, wonderful. So I'll just start again with the introduction. Sorry about that.
That's fine.
All right. So in today's presentation, I'll discuss one of the most common weaknesses of ADHD, some of the ways it affects individuals, and some of the ways in which it can be overcome. For this presentation, I'll use some examples of my patient, Miss Janice Rock, and discuss some of her challenges with ADHD and the treatments she undertook to help her overcome impulsivity. What is impulsivity? So the definition for ADHD is attention deficit hyperactivity disorder. And ADHD is defined as a developmental disorder, not a mental illness or the result of stress in families. The developmental disorder delays affects the child's ability to regulate behavior, control activity levels, inhibit impulsive responding, or sustain attention. And this definition was taken from the book written by Barclay R. and Edwards. Barclay, R. and Edwards, G. Chapter 8, Diagnostic Interview Behavior, Rating Scales, and the Medical Examination in Attention Deficit Hyperactivity Disorder. In Barclay R. 1998, Attention Deficit Hyperactivity Disorder, the second edition, New York, the Guilford Press, page 209. Impulsivity is one of the most common weaknesses of ADHD. Impulsivity is the tendency to act without thinking. Persons with this type of ADHD weakness also tend to have difficulty with time management and being organized. How does impulsivity affect Ms. Rock? Ms. Rock has a tendency to reach to work late, which leads to customer complaints and dissatisfaction very often. So this deals with the issue of time management. She's not always clear on what is important versus what is urgent, therefore making decisions that cause her to miss deadlines or be in a position where she has an ongoing backlog of work. This deals with the issue of priority. She oftentimes feels overwhelmed and cluttered because her life seems very disorganized. And this deals with the issue of organization. So to help Ms. Rock in her treatment plan and the treatment plan for overcoming impulsivity, I will now give examples from the diagram, which is to the right, which speaks about the habits of effectiveness. As part of the treatment plan for Ms. Rock, she was encouraged to apply the following steps taken from this book, 7 Habits of Highly Effective People by Stephen Covey, 2004, New York, Simon and Schuster, page 73. And I will give an illustration of what this diagram actually breaks down in the following slide. So the habits of effectiveness, as shown in the diagram, speaks about these 7 habits which are listed. And the first habit is about being proactive. And this is about setting personal visions. Habit 2 speaks about begin with the end in mind. And this speaks about personal leadership. Habit 3 discusses putting first things first or prioritizing. And this speaks about personal management. Habit 4 is about thinking win-win. This is about interpersonal leadership and ensuring that a favorable outcome is brought about to both Ms. Rock and the other parties involved. Habit 5, 6 is about seeking first to understand and then be understood. This deals with emphatic communication. Habit 6 speaks about synergy, creating a cooperation and unity. And habit 7 speaks about sharpening the saw, which is balanced life renewal, being consistent as well as persistent. Overcoming impulsivity, priority by understanding importance and urgency was also discussed with Ms. Rock. So everyone, let's do an exercise. As we look at the diagram shown, diagram 2, which speaks about time management matrix with 4 quadrants. So let's think about 10 activities you did in the last week and list each of those activities based on the categories of the 4 parts of the quadrant, which speaks about what's important, which is the first quadrant, not important, the second part of the quadrant, urgent and not urgent. So just to summarize some of these activities to help you in your exercise, the first part of the quadrant, which speaks about important and urgent activities, deals with crisis, pressing problems, deadlines driven. All right, and the second part, which is not important but urgent, the second part, which deals with important and not urgent, this deals with activities such as prevention capability, improving. It also deals with relationship building, recognizing new opportunities, planning, and recreation. The third part of the quadrant deals with activities such as interruptions, and this is not important but urgent. So things like emails or calls, some meetings, pressing matters, popular activities, those things can be categorized as not important as well as urgent. And in the fourth part of the quadrant, it speaks about activities that are trivial, things that have you busy, like some emails, social media, some phone calls, time wasting activities, or pleasant activities. That is not important, nor is it urgent. So as we helped Ms. Rock understand this, it was able to help her prioritize her life based on these this quadrant with these four sections. The other thing that was done to help Ms. Rock was to help her develop a time management schedule planner. This planner was also taken from the book 7 Habits of Highly Effective People by Stephen Covey, 2004, the New York, Simon and Schuster, page 174 to 175. And in that section of the book, it discussed how to create a schedule that can break down different tasks and activities, whether it is weekly, whether it is monthly, whether it is daily. And this can help one prioritize their life and be focused on what the tasks are at hand. And as Ms. Rock underwent these different treatment plans, and as she read the books as well to help her understand more of how to prioritize her life, she actually experienced victory. And I'll share and outline some of her victory and the testimonies. So after 3 months of consistently and persistently developing these habits and applying these principles, Ms. Rock has become more patient with herself and learned to take small steps towards her best self. She also began to trust more in Jehovah and believe him for healing, restoring, and helping her overcome her challenges. She made peace with the people she had wronged and apologized to her customers who she would have disappointed. She started to improve her health by diet and exercise, because this is also an important part of treating any type of challenge when it comes to ADHD. She became better at time management and more organized. And she also feels more accomplished and fulfilled. And she's grateful to Jehovah and the support that she received from these treatments. And this is the conclusion of the presentation today. I will now.
Joanna,
Wait a minute, let me do this.
it's important that going through this chart, especially the 4 quadrant, excuse me. Quadrant number 2 is the key of treatment. Okay, so it's about not urgent but important to organize our relationship with ourselves and others. So I will have the law put more emphasis to more detailedly explain this. Good that you put it up, and then so the vision will be expand by the activity of quadrant number 2. So put more focus on quadrant number 2 for overcoming impulsivity. If the law from USA, you need more time, I'm going to put you host now. If you need more time, and we can continue with the second session. So I'm going to put you host now. Austin, want to see the whole head, not the ceiling. Okay. Let me go to participant and the law from USA. Make host. Okay, I'm going to make you host. Now you host. Good. Go ahead. They lost. I want to see whole head. Okay, there you go. Make sure the whole head, not the okay. It's okay now.
Okay. Okay, I don't see me being the host yet.
I see you. Keep going.
Yes. Okay, I don't have the ability to share my screen here. Okay, let me just see what happens here. Okay. Okay. Okay.
Coming.
So,
Wonderful. I see.
okay.
I see it.
Okay. Overcoming impulsivity. So we're going to be talking about that second quadrant that Dr. Santy mentioned. I'm Dolores K. Ford and Miss G in the following discussion. And I applied the 7 Habits of Highly Effective People by Stephen Covey, 2004, from New York, Simon and Schuster, to show some guidelines and example of overcoming impulsivity. Okay, activities. This is the section that I was referring to. Overcoming impulsivity is to protect our mental, physical, and spiritual health, as well as that of the others' mental, physical, and spiritual health. Given the opportunity to learn, even from mistakes, helps one to improve in emotional and spiritual development, while at the same time may give one the desire to attend to their physical needs. This can be accomplished by implementing decisions and activities that put importance over urgency. We need to understand that before being understood, we need to understand before being understood, and that is imperative. For example, the boss forgives the employee who makes careless mistakes in calculation. As a result, he loses $2,000 because the employee was experiencing trauma due to his wife's extramarital affairs. The employee was very grateful to the boss for forgiveness. One's priority should always be people-centered. Embracing the concept of people priority fosters relationship building, preventing of undesirable outcomes, promotion of one's self-esteem, and planning and implementing guidelines to produce desired outcomes. People priority is more important than urgent fix and problems of things, events. People's needs are more important than losing money or immediate accomplishments. So we're going to take a look at quadrant, the summary of the results of the activities of quadrant 2. And let me just see if I can move this up a little bit. When addressing the concept of vision, perspective, balance, discipline, control, and new crises, the following paradigms should be considered. There should be a clear vision of what the outcome will be. This is obtained through the application of discipline to balance activities, thus controlling the circumstances that would lead to fewer crises. Overcoming impulsivity case study. Mrs. G, the grandmother, had a conversation with the father of Mr. J, who was asked to leave the home at approximately 18 years of age. Mr. G asked the grandmother if he could stay with her. The father encouraged the grandmother not to take Mr. J in because of his obstinance, disobedience, and negativity. Mrs. G, the grandmother, agreed with the father and honored the father's request, which enabled Mr. J to learn from the consequences of his inappropriate behavior. The conclusion, this case provides that practicing the visions of discipline, growth, perspective, balance, control, and appropriate handling of new crises is paramount to overcoming impulsivity. And because Mr. J was not allowed to go to his grandmother's, he had to learn how to handle his inappropriate responses and behavior toward his family. Habits of effectiveness. Practice priorities to choose the importance over urgency. And I'm going to increase this opportunity for you to see this if you can. So hopefully you can see that a little bit better. And this little chart was taken from the 7 Habits of Highly Effective People by Stephen Covey. And so what this is a chart that you can measure what you're doing every day. So there's a weekly schedule. There's an area for roles, an area for goals. So for instance, the role would be, my role would be a teacher. My goal would be to do my homework or scheduling for my students. And then the days, Sunday through Saturday, are I would fill those out according to the priorities. And so the next area down here on the left-hand side is sharpen the saw. And so it's going to help me to attend to my physical needs, such as exercise, any mental acuities that I would need, such as studying scripture, prayer, meditation, that type thing. And that would also go into spiritual as well. And the social and emotional activity would be if I would be around friends, families, people who shares my outlook on life. You don't want to be around anybody that's negative. And so as far as making the appointments out, all of the times are down written from 8 a.m. all the way to 8 p.m. And then at the bottom on the right-hand area there would be what you would do in the evenings. So this helps with time management and organization, which I think would help Mr. J quite a bit. And also when he's practicing sharpen the saw would also be of great benefit for him and for his family as well. So that is my presentation. And so I hope you've enjoyed this little presentation on my case study. Thank you very much.
Yes. Okay, can you put me back to host?
Okay. Just a minute. Yes. So you're the host now.
I have not seen.
Let
May
me
take a
just do it
while.
again.
We soon are running out of time. That's okay.
Okay, it's yeah, you're the host.
Yeah. Let me see if yes. I still see you.
Yeah. Oh, well, I'm seeing you. So let me see. I tried it again. Oh, it says that you're the host on my side.
On your side?
On my side, it says you're the host.
Okay, let me double check on my side.
Yeah.
Yeah, I'm the host. Okay.
Yeah.
So let me share screen now. Okay, everyone see my screen? Everyone see summary?
Yes.
Okay.
Yes.
Yeah, good. Overcoming impulsivity. My student use Stephen Covey's 7 Habits of Highly Effective People. In terms of priority selection, Q2 is the most effective way to determine priority choice. Gover suggests relationship win-win solution is more essential than completing immediate tasks or unimportant or urgent tasks. Once proper priority set, a person can map out weekly activity schedule by putting goals of activity according to the role. The cases I just you guys heard to illustrate the above concepts. I attend a House of Israel UK and Tomodé Yahshua Fellowship at the church at Georgetown, Ontario for a Sabbath worship, Saturday worship. You're welcome to join our spiritual, emotional, physical cleansing training program. If you decide to send us a semi-offering 5 days talk helpful, you can use Western Union. My first name is Santy K-L, last name is Lee. Toronto, Canada. If you want to e-transfer me, you can contact me, contact people at Tomodé Yahshua Fellowship. Go to website, find them out. Thank you for your offering and may Yahuwah reward you greatly. So we finished today's presentation. Now it's time to stop sharing and see any comment. Anyone to say something? I'm so happy we have a little bit time. Delor, can you find out how many minutes left?
Less than 1 minute.
Okay, wonderful, wonderful. So I'm going to talk about evaluation our program next session. So I will I really thank Yehovah. All of you can participate, and